And we're live. Salam, everybody. My name is Reza. You have probably seen me before working with TSN. It's great to be back here. We are also working with the Afghan-American Community Organization, and this is the first AACO TSN collaboration. And we're here to talk about specifically something that is on the lips of everybody right now, not just the Afghan-American community, but everybody across the US and across the world. That's coronavirus, or more specifically, COVID-19. As I'm sure many of you are well aware, coronavirus and COVID-19 has been affecting us in so many ways that we didn't expect. There's a lot of uncertainty. There's also a lot of misinformation. And so we have some healthcare professionals here that from the Afghan American community that are hopefully going to be able to ease some of your fears and help answer some of your questions, especially some of the bigger questions that have been going around social media. And so I want them to introduce themselves. We'll start with Lida Rashid. And we can hear her. Yeah, we can hear her now.
Okay,
Yeah.
as long as you guys can hear me.
Yeah.
Hi guys, I'm Dr. Lida Rashid. I'm a practicing hospitalist here in the Northern California, San Francisco Bay Area. I also have a background in public health, and I work with various health organizations and tech startups doing public health advising. And I'm excited to be here. I think it's important for us as a community to really understand how this disease may impact us as a whole, and how and where we stand relative to the picture with the rest of the communities that we engage with. So I'm excited to begin this conversation.
And
hey, salam everybody. Happy Nowruz. Congratulations to all who are in the medical field and match today. My name's Sood. I'm a pulmonary and critical care fellow in Cleveland. I work in the ICU where, if you have COVID and it gets really bad, you come to the ICU. So that's my expertise. Happy to be part of this call. I'm in no means an expert on this. So I could only speak to my experiences thus far. And if there's anything that I say incorrectly, please correct me. Thank you.
I'm Roz, or Rosalind. I'm a licensed mental health counselor. And I'll kind of be addressing the mental health aspects of a pandemic for this discussion. And I'm excited to be here.
Salam everyone, and Nowruz Mubarak, and happy match day to all the medical students out there. And echoing what everybody else said, really excited to be part of this panel and help address this issue in our community. And my name is Arash Ramin. I'm based out of the Bronx, New York, and I'm an emergency medicine physician currently working in 2 hospitals here.
Awesome. Thank you guys so much. Obviously, there's a wealth of knowledge within our community, and we want to put it to good use here. And also, thank you for reminding me, Nowruz Mubarak. It is Nowruz. It's hard to think about Nowruz right now, but it is supposed to be a holiday. So let's start off with like the most basic of foundational knowledge. What is COVID-19, and where did it start? How does it spread?
So I can speak a little bit about that. So COVID-19, or SARS-CoV-2, as the actual name of the virus is a virus that we think purportedly started in the Wuhan province in the wet markets in China. It's actually part of a family of coronaviruses, so this is not the first coronavirus. SARS, for example, if you guys remember, is also a coronavirus. Middle Eastern Respiratory Syndrome, MERS, is also a coronavirus. So this is not the first time humans have come in contact with coronavirus, but this we'll talk a little bit more about how this is different from some of the other epidemics and pandemics that we've had in the world. Particularly, it's an RNA virus, if anyone cares to know. It actually, at this point, transmission is between person to person, but it is considered a zoonotic disease. And what that means is the initial host, the primary host, was an animal, and the virus ultimately mutated and was able to infect human beings, which other viruses, again, have been able to do in the past. It's particularly at this point still a contact disease, which means that you can only get it through respiratory droplets. And in particular, it actually has to get into your respiratory pathway. That includes, in your nose or in your mouth in order for it to be infective. So on skin, on other surfaces, it actually can't cause any problems because the affinity is for the respiratory tract and the lungs. And that's why we're seeing a lot of the complications of it be in the respiratory pathway. Okay. Having said that, though, the virus itself, and again, take some of what I say also with a grain of salt in terms of the epidemiology and how the virus actually acts, because the data on it is still really sparse and still evolving. But what we do know so far is that the virus can last in the air for about 2 to 3 hours. And some of that depends on factors in the air, such as humidity and heat. And the WHO actually just put out a report this past Tuesday saying that they would like to do more testing, but at this point, they may start to consider it as an airborne disease as well, because it lasts in the air. The primary mode of contact, though, again, is droplet. So, you have to breathe in those droplets. You have to actually get those respiratory particles, the viral particles in your mouth. Someone coughing very close to you, for example, exchanging of saliva, things like that can all cause it to infect you. So I'll stop there, since I think we'll probably have a few more questions related. But
I think that's super important. And just to summarize for folks, respiratory droplets, it loves the respiratory tract, so nostrils, the inside of your mouth, and that's kind of where it sits and it lives. But it also has been shown to live in the air for a couple of hours and sort of just hang out there. And we all know, thanks to Dr. Rashid, that it came about most likely from transfer from animals to humans from China, and specifically the Wuhan province. Now, once somebody gets it, though, Arash, can you tell us what are some of the symptoms that they're most likely to experience that would make you, as an emergency doctor, really want them to sort of call the hospital and get a testing kit?
So the most common symptoms for this virus right now is fever, shortness of breath, and coughing. But however, we are seeing mild symptoms of headache, body aches, fatigue, and diarrhea as well. But if you're having shortness of breath and high fevers that are continuous and coughing, those would be symptoms to be really concerned about. Because it's a virus, it acts like other viruses and can mimic similar symptoms to the flu or the common cold. So it's really important for people to know how to differentiate it from other viruses. And so that's why we're using shortness of breath and cough right now to really help us differentiate it from the other viruses.
Okay. Does the cough have to be productive? Do they have to be producing something from the cough, or should they call if they have a dry cough and shortness of breath?
So it's mostly a dry cough, but I think about 30% of the patients right now have a wet cough. So if you have a wet cough, it doesn't mean you don't have it, but dry cough is more common.
Okay. All right. So dry cough is more common, shortness of breath, and fever. When people sometimes take their fever, they sometimes call the emergency department or the urgent care saying, hey, my temperature is 100. Should I come in? What is the temperature that you think, okay, I got to call the doctor now?
So we consider anything 100.4 and higher a fever in the emergency department. Mm-hmm. And viruses typically go with a low-grade fever, so anywhere between that 100.4, 101. But we have been seeing some higher fevers up to 102 with this virus. But a low-grade temperatures is sometimes the beginning of a virus, so something around 99 and 100. I would monitor your temperature to see if it goes up, and if it does, then be a little more concerned. Okay,
so everybody should go out and buy a thermometer and monitor their temperature, and if it gets to 100, 100.4, and you have shortness of breath and a dry cough, call your doctor.
Yes.
Perfect. Okay. Roz, I wanted to turn to you for a sec. This is all really scary. And some of the things that we've seen on TV with toilet paper being gone, hand sanitizer being gone, people bum rushing the grocery stores. How do we know when our reactions to stress or other people's reactions to stress become excessive and not really good for us? And what can we do to help that?
Well, I mean, I guess the first thing would be that, everyone reacts differently to stress or crises or traumatic events. And I mean, the nature of those things, I mean, they all evoke anxiety, fear, uncertainty, stress. But it's usually when those things become excessive, where, for example, everything is either like black and white. We start like catastrophizing. Fear becomes so overwhelming that, for example, we go out and buy all the toilet paper in the store, all the hand sanitizer, and so I mean that's when usually. I think unfortunately panic is contagious. Anxiety is very contagious, and so when we see people in our own social community or in our family, and we hear I mean we have for example, my family, we have a group text message, and I can see when one person sends, especially if it's like one of our my uncle or like an elder, and they send a message, and everyone listens, and if it's fear based or if it's a little bit anxiety provoking, that it can, I mean, literally you can see the whole group, like alarm bells go off and everyone's like, oh my God, we have to go do something, so I think that when anxiety becomes panic, I think that's definitely a sign. And I'd also say that anything that starts interfering with your daily routine and your functioning, if you're, have trouble sleeping, if you feel depression for, more than a couple days, for example, if you're crying frequently, if you have, fear of, going to not crowds, going to like, public spaces, like going to the grocery store, severe emotional stress, feelings of depression, anxiety, anything that really causes you significant distress for 2 to 4 weeks, that's something to be really concerned about.
Now, Sood, I'm going to lob this question to you. This is a question from the audience. Tura Arsala asked this question: what advice would you have for folks who have long-standing health issues who are afraid of the future? And what do you think they should do in terms of managing any symptoms that might come up, or when they come to you in the ICU? Hopefully they don't get there.
So, the issue of chronic disease is a complicated one in the U.S. because primary care is something that we don't have a good primary care system in the U.S. Due to access, due to lack of primary care doctors, due to this whole, there is a large culture that doesn't believe in primary care, and that if I feel good, why do I need to go to the doctor? So what I could say is that, not only with COVID, with anything, with just getting your normal cold, with getting a urinary tract infection, it just takes one little stressful event to cause this downward stream of causing acute problems on top of the chronic conditions that you do have. So your body's reserve and ability to recover from that acute illness is hampered. And whether it's coronavirus or another type of virus, unfortunately, what this highlights is that if you do have a chronic illness, be strictly compliant with your medications. Go to your doctor when you're supposed to go to your doctor. Watch what you eat. If you have diabetes, make sure you're very strict with your carbs. Make sure you're taking your insulin. You're checking your sugars 3 times a day. Make sure your sugars are in that normal range. And if they're not, call your doctor. If you have high blood pressure, make sure stay away from foods with high sodium in it. Exercise more. Make sure you take your blood pressure medication more. Again, meditate. Do things that, avoid stress, which is, having the help of a therapist helps as well. So if you have chronic diseases, just be very strict about taking your medicines, following up with your doctors, and, starting to lead that healthy life. And the other thing too, and this speaks to the Afghan culture, when you have chronic diseases, in Afghan cultures, we're very giving people. When we go out to eat, you're not even done with your plate, and they
They share the food all the time.
And stuff on the food.
Mm-hmm.
Don't be afraid to say, hey, listen, this is bad for my health. I don't need that second plate of food. Things like that, that you need to be very diligent about. So
adding in some primary care just at the end. Yeah. I like it. No, I like it. That's awesome. I want to get to one of the questions that I think will help people understand the severity of this pandemic. And I see that, Lita, you've put in some notes, and I'm hoping you can go over those. But how serious is this coronavirus pandemic, COVID-19?
Yeah, no, it's a great question. And I think, let me preface the answer by saying, again, we don't know a lot, right? So one of the ways you can understand how serious an illness is by using something that we call a case fatality rate in public health. And that essentially means, how many people died who actually had the disease, right? So your numerator is who unfortunately passed away, and your denominator is how many people got the disease. And unfortunately, what's happened, as I'm sure all of you have been following, is we are not testing very often in this country. We are not testing to the level that, say, South Korea had been testing, that China or even Italy has been testing, Taiwan, for example. So we actually don't know our denominator. We don't know how many people actually have the disease. So it's really tough right now for epidemiologists to be able to say, what, here is that case fatality rate for COVID-19. What we do know, though, in looking at various mathematical models that have come through other countries that are well ahead of us, 4 weeks ahead of us, like China and Italy, for example, is that it's somewhere around 2.3, okay? So 2.3, to give you some reference, is about 20 times higher than the annual influenza, the annual flu that we get, okay? So it's got a high fatality rate. Mm-hmm. In comparison to, for example, other coronaviruses such as MERS and SARS and, for example, Ebola, it's actually much less. So we know that it's not going to be as fatal as Ebola, for example, but we're starting to still see that it's probably going to be more fatal than our annual flu.
So what do you say to people online who are like, well, there's 3.4% mortality rate. That's nothing. That's totally fine. 97% of people survive this.
Yeah. So what I usually say to that is, again, referencing that this current statistic for case fatality is everybody that's been tested. So we don't know, right? Mm-hmm. That's the first thing. The second thing I tell people is that, unfortunately, we are seeing a change in distribution in terms of the fatality rate across different demographics. So we're seeing people who are in their 20s and 30s and 40s get it, but what we're really seeing is people in their 50s, 60s, 70s, 80s, that fatality rate goes up exponentially. So right now, the fatality rate, the predicted fatality rate for somebody who gets this, who's above 70 years old, is around 15 to 20%. So that's a huge number, right? And when we think about what the prediction for this virus is, which is, and I don't know if many people have heard this, but the most recent data suggests that about 40% of the country will be infected. Which, out of that 40%, if you think about, even a 2% mortality rate, God forbid, a 10% mortality rate in the elderly, the numbers can really add up. Yeah. So that's sort of the first, piece of this. The other reason why this is a disease that I think worries scientists and worries, sort of everybody to the degree that it has, is that it's also different from other coronaviruses and has a very long latency period. Yeah. What that means is from the time that you actually get the virus, get infected, and the time you actually show symptoms, that can be anywhere from 3 to 14 days. And that 14 days, is a very long time. So what that means essentially is that you can be completely asymptomatic, but transmitting the disease to everybody around you. Mm-hmm. And right now, what we know is that for every one person that gets infected, they are infecting about 2.2 other people. Mm-hmm. So that's really the premise. If, I'm sure we'll talk about the social distancing and sort of the lockdowns that are going on. For example, in California, we have a statewide lockdown right now. That's really the premise for this social isolation, that we need to start separating people who may have the virus, not necessarily symptomatic, but who may actually have the virus and be asymptomatic, from people who don't have the virus, so that we slow the spread of it. Okay?
Yeah, and I mean, I've been hearing that social distancing is super important to do, quarantining, isolation. Arash, go ahead, sorry.
Yeah, I just wanted to add, like, I've been reading a couple articles, and a lot of people are probably looking at numbers right now and seeing, like, based on the numbers, how bad the situation is. And something I didn't think about myself is that when you look at the number, like the numbers that are given per day are when the test results, and it takes, depending on the institution, anywhere from a day to 5 days. So if a person gets tested today, their results come in 5 days. They're tallied for the day that the results come in the maps. So if a person, when like Lita was talking about latency, like if you go from day 0, from the day this person was infected, might not have symptoms until like day 5, and then that's when they go get tested, and on day 10 we get the results. And between that time from when they got it and they got the results, 10 days pass by, they might have already transmitted it to so many other people, and we didn't know, and our numbers are not very accurate. And the new projections in the paper show that in our country we are probably at 1 million infected, based on the data that we have, and because a lot of people are just walking around and they're not symptomatic.
Yeah, and that sounds like the dangerous part. And Roz, just going back to when you were talking about people panicking, what are some of the common reactions to something like this? And more importantly, I think, what are some of the common reactions to the ways in which we try to contain something like this? I mean, social isolation is not easy for people in the Afghan-American community, I don't think. Not from what I've seen, at least.
Yeah, I actually was reading an article today. It was in the Lancet, and it was a review of the psychological impact of quarantine. And they reviewed studies from, I think it was SARS and Ebola, and H1N1. And they found that for patients and as well as healthcare professionals who were quarantined, that they showed negative, like, psychological effects like post-traumatic stress, symptoms, confusion, anger, and that the longer the quarantine, the worse off usually people were. And we're talking about 4 to 5 years after, the pandemic is done, that people were still showing signs of post-traumatic stress. So there's a lot of boredom. There's also inadequate supplies like grocery stores or medical, inadequate information or misinformation or too much information. Yeah. And then also I think there's also a stigma attached to it as well, which is one of the things the article talked about was, that, people go into quarantine and of course, you guys can answer this, but I mean, when is it we're done with our quarantine, we're okay, we're feeling better, and we're stigmatized for it. People don't want to be around us afterwards. So there's even kind of a lag after you get out of quarantine. There's still a period of like adjustment for yourself as well as people around you, because I think, people are still scared, like, is it really gone? Can I still get it? So that's definitely, a huge fear. But I think that, I don't know anyone, thank God, yet, but I know that eventually I will, in terms of quarantine. But I think, we have social media and technology for a reason. I think it's one of the best things that we can do. And I think we have to get creative in ways of doing this. My cousin's wife had a birthday the other day. She's in Nebraska, and we got like a whole bunch of us together. We did a virtual happy birthday.
Oh, nice.
Toast, we had to get creative about these. I feel uncomfortable doing those kinds of things, but I know I'm going to have to get comfortable. So I think it's important to do that. And especially if you know someone who's quarantined, I think it's so important to reach out to them, offer to buy them groceries and leave it at their door. Those things are really, really important because I think that quarantine, from what I've read, is the worst. And the isolation is the worst part of this, psychologically speaking.
I can imagine. But it's so important that we practice that social distancing and that kind of isolation. We're getting a ton of questions. So Sood, I'm going to start off with you because you have something to add.
So actually, one part of the quarantine, and I actually want to bounce this back to Rosalind, that from the ICU perspective is that we are, just throughout the hospital, we are limiting who can come to the hospital. And from the ICU standpoint, the other psychological effect that this virus is having is one of the collateral effects that it has, in that we can't let patients into the ICU. So more patients that don't have coronavirus are passing away as well. And when we're having these conversations like, look, we've done everything we can, your dad or your brother or your husband or wife is passing away, you can't come in when we're withdrawing care. That's also having a significant psychological effect. And actually, I want to see if you could talk about that as well, Rosalind.
Yeah, I mean, I think that's part of the uncertainty and, the fear of the unknown, and the lack of resources for a lot of people. It's kind of crazy living in America, but right now it seems like we're tackling this from a place of scarcity, which I think is just wild. But I think that, and I think this is, and also just, as someone, I pay attention to the news a lot. And so I think I'm pretty well informed. However, I'm still a little confused, about, what, if I'm showing symptoms, and I'm not an at-risk, person, do I just write it out? What do I don't know. I'm not 100% sure. I think that's one thing that I think that all individuals, and even as a family, to do it, I think it's really important to have a plan and consult your healthcare provider, your physician, and get them to help you. So you have this plan so that when something does happen, that you're ready, and that you don't have to, be you're going to be frantic anyway. It's going to be, a horrible experience. So I think it's important to have that, because preparation is the one thing that does reduce anxiety. If you have that, prepared, and you understand step by step what to do, that will definitely help in terms of showing up at a hospital when knowing not to do that, for example.
Awesome.
I don't know if I answered your question or not. I'm not sure.
So you brought up something that I think is super important. Somebody asked this question. Nazia Fazli asked this question: what if you have 2 or more of the symptoms, but don't fall into a high-risk category? No shortness of breath, not over 50, et cetera, et cetera. Should you still get tested, or should you just write it out in isolation?
So I think the answer to that, again, I'm with you, Rosalind. I'm just floored by our lack of readiness for this as a country, as the United States. But to answer the question, I think it's really going to almost depend on where you are in the country. Someone said this the other day on one of the forums that I'm on, and I think it's a really important point to remember, is that the United States as a whole is not going to be one big homogenous COVID example, right? Because right now, as you know, we have clusters happening, right? New York is kind of feeling the burn. California has a tremendous amount of cases. There's really only about 10 different areas in the country right now that the majority of the clusters are coming from. So what does that mean, right? What that ultimately means is the availability of testing is probably going to be a little dynamic. It's probably going to change over the next few weeks. But as of right now, where we stand, and I'm sure the other physicians on the panel can talk about this as well, where we stand within our health system, if you just show up to the hospital and you have one of those 2 symptoms, the emergency physician is probably not going to test you, because we just don't have enough testing kits. And they will probably tell you what the majority of sort of the media is telling you, is that if you're not having severe symptoms, if you're not, significantly short of breath or having chest pains, or you're breathing fine, but you have these other symptoms, you should actually just self-quarantine. You should stay at home, and by self-quarantine, you actually should self-quarantine from the people in your own home too. So I've had examples of patients, for example, quarantining one room for their, for that person. No one's coming in and going out of that room. And that's how they're doing it to prevent, if they have it. Because again, at this point, you're not able to get testing. There are some communities where it is widely available. So I think a point was made earlier. Call your physician, call your primary care physician. Don't just show up at the door. And I can't stress that point enough. because, one of the things I'm seeing a lot on again, the physician forums is that we are getting bombarded by patients who are showing up who are not only putting themselves now back at risk, but are putting sort of other people at risk. So the best thing to do is actually just call your primary care provider, call the Department of Public Health, and we're all working through algorithms right now that says, here's the patient that really needs to come in and get tested, and here are the patients that don't. If you have any questions about it, that's what I would do.
So in New York, actually, it is a big problem because our numbers are really high and our swabs are limited. And I believe the swabs are limited countrywide. So we are reserving it for the people that are sicker or higher risk. So I know that as an emergency medicine physician, when people are coming in, we're actually screening them and we're telling them you might have it, but this is not the place to get tested. This is a number that you can call. This is we give them the hotline number and we tell them to go home, quarantine themselves, call, and then they get an appointment. So if you have symptoms and they're mild, I recommend that you call your primary care doctor. You can try urgent care, or there in New York, we have testing centers now. I know a lot of states across the country are opening testing centers. You can call and see if you can do one of the drive-thrus. The only time I really recommend people go to the emergency department is if you actually feel sick where you're not able to hold anything down, you're not eating anything, drinking anything, your fevers are really high, and you feel short of breath. Like the shortness of breath is a really important one where you might need oxygen supplementation, and the only way to get that is at the hospital.
And just to echo off their points, every state is different with how they test. I was speaking to a friend in Chicago. He's an ICU doctor over there. It still takes them 5 days to get the test, whereas here in Ohio, it's about 8 to 48 hours. In Dallas, they're not even doing the testing. It's there, but it's not in a large amount. They're just asking travel questions. What I could say is that if you have significant chronic illnesses, even if you're younger and you're on any kind of immunotherapy, prednisone, Humira, things like that, or if you have been in a region or in an area that has had significant amount of these cases, come to the hospital. But really the thing to echo is the shortness of breath, because the time so there's two issues with the shortness of breath. The progression to the severe respiratory illness with this is actually pretty fast. So you come in, you have shortness of breath, you require oxygen. The time from oxygen to actually requiring life support, it actually escalates very quickly. The other thing is that normal non-invasive means of actually ventilating patients is actually risky with COVID right now because of the fact that the non-invasive ways of ventilating can actually aerosolize and cause your own respiratory droplets to go out into those rooms. So those patients require negative pressure rooms to keep that air in, but there's not that many negative pressure rooms as well.
For sure.
So really emphasizing the shortness of breath and coming into the hospital.
So I just want to quickly summarize things for people either just joining us or who may have had some trouble following along. If you are experiencing shortness of breath, it's not really about showing up to the ED, but it is about calling your PCP, as Lita said. And if you are somebody who is not in one of those at-risk populations, self-isolation and quarantine is going to actually really help you and really help the people in your community around you stay safe. Is that a fair sort of like one-liner? Shortness of breath, watch out for that. Call your doctor. Don't just show up to their doorstep. But if you do feel like you aren't able to walk up a flight of stairs, or you are falling apart, or you're vomiting a ton, go to the emergency department.
Yeah, I mean, I think we need to your point. We need to emphasize that particular portion. If you're having shortness of breath, you should be going to the hospital.
Okay.
And I think my physician colleagues would agree with that. I think what you were saying earlier, Orashan, was just that, if you're having like low-grade fevers, you just don't feel well. All of us have had, viruses, right? Some of us had the flu, some of us had like sort of rhinovirus, all these other viruses. You just don't feel good. You feel a little sickly, but you're eating, you're drinking, you're going to the bathroom fine. You certainly don't, aren't short of breath as you're speaking sentences. Those are the people that I think need to self-quarantine and call and, go through those other first few channels before showing up to the emergency department. But if you're short of breath, I think we can all agree those people should be going to the hospital.
Awesome. We're getting a ton of questions, as I'm sure you all expected us to get a ton of questions. And I want to thank everybody who's watching for sending us their questions. Because we're getting so many, we may not get to yours, and I apologize profusely for that. We will do our best to get to them in the Facebook comments if we don't get to them in the call right now. But I want to dive into some of them right now. There's one from way back towards the beginning of our conversation. Razia Khoromi asks, do the symptoms start in steps, or do they present themselves all at the same time? And it sounds like it's variable from what y'all are saying, but I wanna push it to you guys.
I'll take this. So it can be variable. Everybody's body reacts differently. So there's no way to say that you'll first feel a fever, then you'll get a cough and feel short of breath. For some people, it might all come at once. For other people, it might come in slowly and they might not get some of the symptoms. So there's no way to really answer that question. Everyone's symptoms will vary. And it depends on many factors, such as your age, your comorbidities, and how your body reacts.
Okay, so it's variable, and it's hard to predict whether they'll come on all at once or stepwise. Someone else asked, and I'm not going to say their name because they gave us a list of their symptoms, but they were saying that based on all of their symptoms, they have been to an emergency department twice this week, but they still haven't been tested. How do you all in the hospital determine who gets tested? Is it just based off of the shortness of breath, or are there other things that are also involved that you want people to know that, like, okay, this is going into my algorithm and this is why you're not going to get a test?
Yeah, we have a protocol. I'll let everybody else sort of answer. So.
Okay.
Agree. We have a protocol, and our protocol actually changes every day. So if you don't fall within the algorithm, then we redirect.
Okay. And I think that's really important to note for people who are not in the medical field who are watching this. These protocols that your doctors are using in the hospital, whether you're in the urgent care, or the emergency department, or your PCP's office, they're changing every day. And they're changing based off of the new science and the new facts that we're getting every day. And so it's the physicians and other healthcare providers that are seeing you are changing up their game and pulling audibles, so to speak, really quickly and on the fly. And I think they all understand why it can be frustrating. Someone else asked, they said that they have COPD, and I'm also not going to say their name because they identified a chronic illness that they have. I have COPD. What precautionary action should I take just in case if I get this virus, and what should I do to prevent not getting this virus?
Yeah.
And I think we answered that last part a little bit with the social distancing and the quarantining, but this question, I think, is where I want you guys to hopefully address some of the misconceptions around things like face masks and hand sanitizer, because those things are flying off the shelves and they're on the news everywhere. Are those some of the precautions that will help people? Like, is wearing a face mask helpful?
Yeah. So I think people have been saying it, and hopefully it's like, plastered in everybody's mind, right? That the number one preventive measure is hand washing, right? Now, number one, I mean, your hands should be dry. I've been telling people your hands should be dry right now. Every person in this country, their hands should be dry because that's how much they should be washing their hand. Sanitizers work okay. They have to be at least 60% alcohol in order to be effective. But hand washing is still, gold. Okay, so all these, people going around, hoarding hand sanitizer, soap is much better. The virus actually has a very thick, what's called a very thick lipid layer. And so soap works better in actually breaking, it's a fat layer around the virus. And soap works much better at breaking that fat layer apart and keeping the virus from continuing to replicate. So that's why you want to use soap, because the science actually says soap works a lot better. Face masks, I'll let you guys sort of talk about that too. I think there is still, there isn't hard and fast rules about who should be wearing face masks. I think we all agree collectively that if you're exposed regularly to somebody, so health workers, EMS people who work in nursing homes, people who work in dialysis centers, all those people should be wearing face masks. But, should you as an individual who's out and about town be wearing face masks? I think, you have to sort of make that decision for yourself. Ironically, there's some epidemiological data that says when people wear face masks, they actually touch their face more because it's around the nose, it's around, they're constantly moving it, adjusting it, wanting to talk. And if that is you, then no, don't wear face masks. But I think the average healthy person doesn't necessarily need to wear one for any reason. Just maintaining that distance of 6 feet, washing your hands regularly, not touching your face too much. If we do that, if 90% of the country does that, we will do what everybody's been talking about recently, right? Flatten the curve. We will flatten the curve. China has shown that they did it. South Korea has shown that they did it. Taiwan has shown that they did it. If you get people, unfortunately in this country, we can't do those sort of draconian measures. We're a democracy, so we can't force everybody. We can't quarantine large cities. But that is what essentially was done in China, and that's how they flattened that curve. So it's a sort of a long-winded answer, but that's my medical opinion.
No, you gave clear-cut advice. Wash your damn hands. Hand sanitizer needs to be 60% alcohol. And if you are the kind of person who touches your face a ton, then maybe don't wear a face mask. If you're a healthy person, you're walking about town, it's not necessarily crucial that you wear a face mask. But you work in a dialysis center, you work in a senior home, you work in the healthcare field, wear a face mask. Perfect. Sood, I think you wanted to say something.
So just to talk about touch base about the COPD.
And can you mention what COPD is, just briefly, super briefly?
So COPD is chronic obstructive pulmonary disease. There's 3 different classes, but the essential component of COPD is that your ability to actually exhale the air that you breathe in is diminished due to the fact that there's actually changes in your lungs that prevent it from bouncing back to normal, is I guess the simple way of putting it. The one thing about COPD is there's different severities to COPD. So the more the severe your COPD, the higher risk you are at, not only with COVID, with anything, just even dust particles around your house that you may be allergic to could set you over. So the important things for the patient, the person who has COPD is if you're smoking, please stop smoking. The other thing is use your actual MDIs, the inhaler itself, instead of the nebulizer machine that you have. And if you feel like you're actually, and the way to use it is you put your mouth over it, you take a big deep breath over like a 10-second period, and you actually hold your breath for a couple seconds, hold it in your mouth, and then let go. It's not a quick and that's it. It's more, you hold it in and then you let it out. So that's a proper technique is important. The nebulizer machine could spread the virus around if you have it. So I wouldn't use that because that could contain other people. And then really look at your functionality. So if you're someone who has COPD and is, and can walk up a flight of stairs, but now you can't walk up a flight of stairs, call your doctor, come to the hospital. I mean, even if you didn't have COVID, if you're having these symptoms with your COPD, you got to call your doctor and come to the hospital. And if you're having significant wheezing as well.
So if you have COPD, meaning you have a chronic lung disease, a lung disease that's lasted with you for a long time now, and you experience a different sort of ability for yourself, different from the norm. Maybe you have low ability to begin with, but it's now lower, come to the doctor. All right. So this is something that I want to throw to Roz because it's about talking to older parents. So Rabia Khan asked, what are some facts you can share for the younger generation to convince their parents and older generation to take social distancing seriously? And I kind of want to like broaden that question out. How do we talk to our older parents who are not taking this seriously? How do we make sure that they do? How do we make sure that they understand the severity of this?
Yeah. So I was actually a little surprised because my thought, because I'm basing it on my mother, right? So my thought was everyone's Afghan parents were like super freaked out about this and were being unusually, careful. So that was so when I heard, I got that question, I was surprised. But I mean, like I said earlier, everyone's reaction is very different.
Mm-hmm.
And I think, one of the things, my dad's 87, so he's, high risk.
Mm-hmm.
And luckily, knock on wood, he's very healthy, but he wasn't taking it that seriously. Like he wanted to go to the movie theater and he, wanted to go to his favorite like seafood restaurant to get some crab and, stuff like that. And so, and I was a little surprised, but I think part of it has to do, I think this is universal. It's not specific to Afghan culture or anything. I think it's kind of universal that people who are considered at risk in these circumstances, I don't think under any other circumstances they'd be considered at risk, right? So, the first time looking at kind of like being part of that older cohort and being lumped into that category, I think a lot of times is a little jarring for people. So that's one thing. I think that's kind of just a universal factor. And I think that in terms of how we talk to them and address them, you guys know your parents better than I do, and I think you have to kind of play around with things and see what works. I think yelling and being aggressive about it, that's not. I don't think that's a very effective. In fact, I think it's a little counter productive in terms of especially when we have our stubborn parents, who think they know everything and they've been through so much more than us, which is so true. They have more wisdom than us, but I think that it's important to kind of play around. Like I had to do it with my dad, and for me, I have to admit it was using a little bit of guilt and also kind of using statistics that are really jarring. So I had heard from someone, and I don't even know, don't quote me, I don't know if this is true, the doctors can let me know, but I told them that 5 out of 6 people who contract coronavirus who are over the age of 80 are more than likely to die. So I threw that out at my dad, and that shook him up. So that was something. So we really started paying attention after that. But I think also another way to is to kind of ask them questions like, what do you know? Because I think that's really important. Like if we just kind of go after them and we don't know what information they're holding in their heads to base their decisions on, then they could have totally wrong information, for example. So that might be the first step. Well, first we need to have the right information, and then we can maybe talk to them about what's going on. So I think asking them what kind of information they have, where are they getting in their information, and then telling them what your worries are. I think that's very important. And these are the precautions and the steps and actions that I'm taking. And tone matters a lot. And I think it's important that appealing to your parents' love of their children, as well as your love for them, can be really powerful. I did that with my dad. I was like, listen, I'm not ready to lose you, so I need you around for a little bit longer. And I think that's I think it'd be hard for any parent to kind of shoot that down. So I think that would be really important. But I think it's also important just to understand our parents are coming from Afghanistan, and whatever their experience of trauma or war experiences or poverty, whatever it may be, that helps them, and it's a big part of how they're making their decisions in this crisis. So I think it's important to keep an open mind with that and kind of try to understand where they're coming from, and they are doing the best that they can.
So try to meet them at their level, but also use a little bit of guilt. But try to infuse that all with love. Like you're limiting their actions because you love them, but right. Damn it, Dad, a lot of people die from this, so stay home.
Mm-hmm. Right.
Okay.
Right. Yeah.
Perfect.
Yeah.
Perfect. I love that. That seems to me to be a pretty clear strategy, using a lot of the information that we've gotten here. An interesting question that was posed by Madina Nurstani: wouldn't face masks have helped if people who are carriers and they didn't know that they were carriers, but they had worn face masks and thus would have prevented the spread of the disease? Wouldn't a face mask helped in that situation? And I want to toss this to Arash, but Sud, please feel free to jump in.
a really hard question to answer because we're gonna run out of face masks if everyone starts using face masks, and that's becoming a problem in hospitals across the country. So it is a respiratory droplet, and that's how it is spread. But if you practice good social distancing with good 6 feet, then the chances are less risky. And if you think you're low risk, wearing a mask is not necessarily beneficial for you. It's more so beneficial for people that are sick, so they can prevent from spreading, or people that are elderly, and one that like has to still go to work and come back to work, maybe they can wear it. I wouldn't necessarily give the mask to like the younger people. It's more important for the elders that are at risk or people that actually have symptoms. I just also wanted to add something real quick regarding family. So I know that some of us are having a hard time with convincing our parents about the situation and getting them to get serious about it. But I feel like there's also things that we can do to limit the spread of this virus. So I feel like a good majority of the Afghan community is practicing isolation with their families to the best of their ability. But you still hear of cases of where people are still having like get-togethers, and we come from a community where, family gatherings are very important, and it happens almost on a weekend basis. There is a community out in New York, and I'm not going to say exactly which community, but they haven't been following the regulations that are put out by the mayor and the governor, and they continue to do their big family gatherings, and they continue to celebrate their holidays in large numbers. And now they have seen a huge surge as of today in their population. So I don't want this to happen to our community if we take the right precautions and we all stop having our get-togethers. And I know right now, like to Rosalind's point, having like virtual get-togethers, everyone has like a phone now and has a laptop, so doing things virtually, and also limiting visits to elderly people. So I know a lot of people have grandparents. Usually children are like vectors. They like carry it and they don't have symptoms, or like younger people up in their 20s like don't have symptoms. So I know visiting our elders is very important, but at this time it might be more of a risk than to go visit them, and they might not understand that. So maybe trying to do a phone call or a FaceTime instead of going and meeting them.
All right.
I'm wondering if I can add one thing to that, because I think those are really great points. And I'm going to make sort of a professional/personal plea here with regard to face masks, right? So in general, the WHO, CDC do not recommend face masks for the average healthy person, right? But what have we seen in this pandemic, right? We've seen a lot of people buying en masse the regular face masks, and then what we call the N95 masks, the ones that are fitted to size and more like surgical masks. So certainly the average healthy person does not need that. But what's happening is that more and more people, just through a little bit of hysteria and fear, are actually buying those. The people who actually need them, the healthcare workers, the frontline workers, the ED doctors, the ICU, the intensivists, the hospitalists, all of these guys, the nurses, for example, are not able to get them. Mm-hmm. So I'll give you an anecdotal experience. I was in the hospital just a few days back, and I had to make a call, myself and my nurses, to decide who are we going to use these very limited supply of masks that we have on, right? And the reason that's a really important is because certainly I care about my health and the health of my nurses, but if I get sick, I'm going to get a lot of other people sick. Meanwhile, there's N95 masks sitting in people's garages, right? So it's a really poor, a lot of people have been saying this, and we're hearing this a lot from Dr. Fauci and some of the other people at the CDC, that we really are in this together, right? If I get sick, that's not good for you. That's not good for whoever's in my community, not just whoever's in my household. So the best thing we can do is take the measures that prevent spread. And data shows that just wearing a mask by itself actually doesn't completely stop the spread of the infection. You still have to maintain those hand washing and hygiene measures, because these masks, again, are limited in what they can do. We want to reserve them for the people that actually get exposure very close to COVID positive patients. And I think, I don't know if it was Arash John or Sue, you guys said you had 4 this week alone, right? You need to be able to get those masks. So that's my personal plea to everybody, not to hoard the masks, so that the frontline workers can really get to them when they need.
Okay.
So I work at a hospital, 100 beds, and I actually had this issue last night where one of the COVID patients I had needed to get put on, they needed to get intubated, in that they needed a tube down their throat and needed to be put on life support. And they did not actually have a PAPR outfit for me in that case. So that actually delayed the time of intubation for this patient, and unfortunately might lead to a negative effect as far as the delay in delivering adequate oxygenation to this patient. So, I mean, that's just one anecdotal piece of evidence. And, before this entire pandemic happened, no one would have even thought that would be the case. So.
Yikes. And that's scary. And I think, setting aside the differences between surgical masks or N95s and whether one is more effective than the other preventing the transmission of this disease, it sounds like, bottom line, buying too many of these is taking away from people who need to treat COVID patients or other patients in the hospital. So pull back, rein it in. There have been several questions asked by multiple people that are the same. If you get COVID once and you recover, can you get it again? And I don't know if that's somebody. Yeah. Okay. Yeah. Great.
I can take that. Yeah. Mm-hmm. Right now, the big answer, the short answer is we don't know. The more specific answer is that there are some cases. There have been a few reported cases. I want to say actually out of Japan, but don't quote me. But there have been some reported cases of people who are reinfected. So that's why I think a lot of people are predicting that this may be very much like seasonal flu, where we will go through, a year to 2 years of, badness, unfortunately, because again, we've never been exposed to this virus. But then at some point, collectively, there will be some herd immunity, right? We will have, we'll not only have knowledge of it and hopefully a vaccine, but also some natural immunity built, and it will become somewhat seasonal, which at that point then means that you can get it, just like, you can get the flu year after year, if, especially if you don't get your vaccine. So get your flu vaccines. That's more important than ever right now too. So
I actually had a quick question to that. So I heard about that one case in Japan where the person, I guess, reinfected, and I was reading the article, and it was actually on Twitter, and then a doctor jumped on Twitter and said that their understanding was that it wasn't that the patient was reinfected, that it was more that it was dormant in the system. I don't know if you can speak to that or not, if you know anything.
Yeah. That's why the caveat was we don't know, right? So because they still have. What we do know is that just like it has a long latency period, it also does have actually a long dormancy period. So people have seen it in, for example, saliva, in the gastrointestinal tract, in the urine, long after the patients have been, have gotten better. So we know it just, it sits around for a while. So in this particular few cases, actually, is this a reinfection? Or is this, the person getting, just symptomatic again, for example, from a prior infection? I think that is just remains to be seen. I think it remains to be seen. But again, the way other viruses that are similar to this have acted, it may be that you can get it, multiple times. Hopefully by then, they're saying about 18 months or so, a year, we have a vaccine.
Right. Okay, thank you.
18 months sounds like a long time. And something that a lot of folks have been bringing up on social media, especially within the Afghan community, is that a few countries like China and South Korea have been sort of coming around the bend on COVID response. And it's getting worse in places like Europe and in America. What do you all think is maybe one or two reasons why China and South Korea or other East Asian countries are coming around on this, and why it's getting worse in places like America and Europe? Just to sort of address some of the theories that are coming out about it, and why there's that difference. So we can go to Lida or Sood or Arash or yeah.
So I think it's important to remember the trajectory of the virus, right? So whereas it started in China, kind of made its way across the globe. So in terms of, why are, some places already doing better, I think there's a few different theories. It's important to keep in mind, however, that we are about 2 to 4 weeks behind, for example, Italy, right? So we will see that same sort of uptake. We'll see the same sort of epidemiological pattern as likely they did, if we continue to, I think, act in the same manner, right? Mm-hmm. So what do I mean by that? I think most of the scientists will tell you that the reason, for example, Wuhan, for example, right, is starting to close down the hospitals, right? The Wuhan province is starting to close down the hospitals that they had built just for coronavirus cases, because Wuhan essentially was quarantined. An entire sort of province was shut out from the rest of China, and China was shut out from coming in, right? So those are the kind of measures that can sometimes actually mitigate this kind of spread. Now, can we do that in the United States, right? I won't sort of get into the socio-political aspect of a lot of this, because that's certainly not my area of expertise. But to the degree that we can self-isolate, to the degree that we can have some of these lockdown places in order, as we have, like I said, just yesterday or the day before here in California, where, California looks like a ghost town right now, but it's okay, right? It's okay. And I think, Roz, you could, your work is going to be tremendously important, because people have to believe how important this particular measure is. Mm-hmm. So if we want to be like those countries that have already flipped the script on this virus, then this is what we have to do. As a country, to come together, as a community, we have to come together and say, sorry, I definitely want that kebab tonight, Khala, but I can't, I can't go far. My Khala lives very close by. I'd love to go see her, but no, we're gonna socially distance. We're gonna isolate. We're gonna give this virus, a run for its money. So that's, I think, what we can do, and I think that's the best example from those countries that have really, shift the curve here.
Yeah, so it sounds like it's more of like a structural reason rather than something to do with the virus itself. It's the structure of those societies, and some elements were maybe not so great or wouldn't fit in America, but that's what helped them. And we're also on a delayed trajectory because it came not first here. Yeah. Okay, perfect. Arash, I think you wanted to add a little bit to it and address some of the other kind of conspiratorial tin hat theories that are going around.
So, as far as to the point as like the countries around China, why they might not be getting it, we don't actually know that. If you look at Eastern countries, most of them are not as advanced. So the ones that are advanced are the ones that are giving us numbers. And they've actually been doing a pretty good job if you look at like South Korea and Japan. The others just might not have the testing. It might have gotten there, but they're also on a late trajectory like the other countries. So you have to look at how advanced every country is when you compare. And then there's also have been some studies recently showing, because they've been doing genotyping of the virus, and they said that there is two types. So they're saying that it's the S type and the L type, and China has the S type, where Europe has mostly the L type, and the L type is more transmissible, so it can infect people faster, and might be more aggressive than the S type that we've seen in China. You also have to look at like how people live in these communities and what type of comorbidities they have. If you look at the European countries, a lot of them are heavy smokers, so they might not have good lungs. Italy is also country with the second highest elderly population in the world. So their numbers are going to be high as far as mortality compared to like China. And then I just wanted to quickly touch on like emergency preparedness because it's really important. So every family and household should have an emergency plan in place for, God forbid, situations like this, not just pandemics, but natural disasters. And of course, we in the USA, like natural disasters are different depending where you are, where like California might get earthquakes and we get hurricanes. So you just need to be prepared for like your climate, and you have to have everything in your household ready so you don't wait last minute and where everything goes off the shelves and then you're not prepared. It's still a little early. There's a lot of resources out there where you can look up on either like the CDC, FEMA, who I'll just look up their emergency preparedness guidelines and have something in place for your household. Also get to know your neighbors and people in your community. If you know there's other Afghan Americans around you, this is a time to probably get to know them, because it might not just be you helping them. If you might not be in the need of help, and they might be able to help you. So try to build like strong relationships at this time, because we don't know what the trajectory is in our country.
Awesome. I hate the fact that like we brought up some of those conspiracy theories on the call, but I think that they're important because sometimes if you ignore them or let them live in a corner of your room, they can just grow there and become more and more pernicious, more and more insidious, and like have a stronger pull on people's minds and anchor them. And so thank you for bringing up those nuances to the data and how it doesn't prove that it's all a hoax from China. So I want to wrap up the call with one question to each of you, and that question is, what can we expect next? And Sud, we haven't heard from you in a little bit, so I want you to start and tell us, what can we expect next?
So, with all the predictions, with more testing that comes out, there's going to be an exponential number of increased cases. And the worry at this point is that there are only 2.3 hospital beds per, I think, 1,000 patients in the U.S. There's 931,000 hospital beds in the entire United States. There is 161,000 ventilators available in the entire United States for the potential millions of people that may be affected by this. So what we can expect next is, if we get the massive surge like we are expecting, is a shortage in the amount of ways of treating these patients. And that's a big fear. That's a big fear, because we don't want to get to the point and deal with something that we healthcare professionals do not fully 100% grasp and understand. And we are doing things on the go as well. And this is something that requires a lot of manpower. Just the 10 or so patients that we admitted this week has required so much from the nursing staff. So props to them as well. But there's a lot of collateral damage that's done to patients who don't have COVID, but get neglected as a result of all the resources going towards the patients who have COVID. Those are the things to expect. At the same time, though, I want to emphasize that altruism is something that we need to practice as a community. Selflessness, wash your hands, and just pay attention to your body. And every day is a different day, and it's a trying time. And just be nice to one another, and vote Democrat.
I love it.
Oh, nice. Okay. All right. Lida, what can we expect next?
So I was going to say, expect it to get worse before it gets better. Okay. I think collectively we should all be prepared for that. Expect that someone will be infected, whether you know it or not, whether you realize it or not. Try as much as you can to support isolation of those individuals who are older than 60, who are immune compromised in any way. And that means, cancers, they're on medications that suppress their immune system. They have heart disease. Particularly, the trend that's been showing is that patients do far worse if they already have heart disease, stroke, diabetes, other respiratory issues, and just any long-standing chronic illness. So support those people in being as isolated and practicing self-isolation as much as possible. So call your, if it's a mom or a grandmother or whoever, call them so that they don't, feel the need and the itch to go outside, because they are the most vulnerable right now and the most at risk. And yeah, to Sood's point, just be good to each other. If you can support. I've seen some groups going out and doing grocery shopping for elderly in their community. I think that's wonderful. These are definitely the times where I think the best of us and the best in us and the worst in us can come out. And I think we can make a choice about, which face we want to show. And Afghans are incredibly hospitable and kind people. So I think I know which way we'll land. Before I go, though, I do want to add one thing.
Perfect. Yeah, absolutely. Please.
A bit of criticism about our, I've been seeing a lot of dialogue in the media about, Chinese virus. And, I know certainly, just even within my own circle, people have sort of some xenophobic ideas about where this virus came from. It is true that it does come from China. It is true that it was passed from animal to humans. But keeping in mind that things like SARS and even Middle Eastern MERS, Middle Eastern respiratory virus, came from camels. So it is, we should take as much caution as possible in trying to, plant this on our Asian community members. I know they're feeling the brunt of the xenophobia at this point in terms of this. So especially children, I've heard of cases of young, Asian-American children being bullied and harassed about this. So as much as we can, let's teach each other that this is at this point, it's everybody's problem. So, okay.
Awesome. No, thank you so much for bringing that up. Words have consequences, and we have to act like that. Arash, what to expect next?
Just to echo what Leader John said. So John said it's same thing. It's just get prepared for it to get worse. I also, from like a non-medical standpoint, like, get used to this lifestyle for now. Like, prepare yourself to live in this type of situation, and don't think that it's just going to go away in a month. So make good use of your time. Like, think about your finances. Think about how you're going to care for your family, your children, what you can do for everyone until this virus goes away and we go back into a normal way of life.
Awesome. Thank you. Then I think that's you're hinting at the reality of the situation. And then Roz, you're the one here I think who would have the most experience in comforting folks and giving them words to get them through situations like this. Maybe not exactly like this, but tough situations. Can you give us some words that maybe we can end this on a high note? maybe.
A lot of pressure. I'll try. So I think one of the things that's really important, we need to keep things in perspective, right? And I know that there's a lot of fear and anxiety, and in some ways that anxiety and the fear that we do feel can be protective, right? It's a survival mechanism. It helps us to get through things. It's a good thing. But a virus can, invade our bodies, but we decide whether it invades our minds, right? And I think that's really important. This is an opportunity where we can embrace kind of the ordinary and get back to the basics and pay attention and take care of of our bodies and our minds and our spirits and other people around us, and getting out of our head. So I think someone mentioned earlier, relaxation and meditation exercises and deep breathing and mindfulness is probably, I would say, one of the most important things that we can do, because anxiety in and of itself it's a very cognitive kind of thing. It starts in our heads and it starts with our thinking. So staying mindful of how we're feeling and what we're doing in the moment and how we can make the best use of our time, I think is really important. And I think just maintaining a sense of hope. I think, one of the things I always say, and I actually practice, I encourage my mom to do the same, is, take, at the end of the night, at the end of the day, to wrap things up and to kind of go to bed positive. Do, like 3 things that you're grateful for today. 3 things, and get like nitty gritty about it. Not like, so grateful I'm alive and I don't have COVID. We kind of getting, I'm so grateful that I got to speak to my aunt in Germany or something, whatever it may be. I think it's really important just to kind of get back to the basics, because we get so in our normal routine when we're not in this crisis. I think that we tend to take things for granted, and I think that this is it's an opportunity to embrace kind of the basics in the ordinary.
And how have you heard of any good techniques for exercising? Because all the gyms are closed.
So I know that YouTube has a whole bunch of things. I know if you check on some of your local yoga studios, they'll do like virtual yoga classes, for example. I know that there's a place near me that does that. And I found one for my, kind of like a senior video for my mom that she can do. So so I've been looking around, and there's also apps. There's great apps. Calm is probably one of the best apps there is. They have a whole bunch of different things you can do there. It's free. So I would definitely recommend Calm.
Perfect. Okay, so app Calm. Go to YouTube for exercise videos. Contact local yoga studios. Expect things to get worse before they get better. Distance yourself socially. Get used to this as a new normal. If you have chronic illnesses, things like diabetes, COPD, heart disease, monitor your symptoms. Watch out for a temperature of 100.4 or higher. Shortness of breath is the most important symptom. And make sure to be in contact with either your local urgent care, your PCP, which is your family doctor, the kind of doctor that you see regularly, before you head to the emergency department and overload them. And please, please, please wash your hands. Be wary of using face masks, because folks here on this call need those face masks to do their job. My name is Reza. This is a collaboration between the Afghan-American Community Organization. Thank you so much at ACO for partnering with us to get the word out about this conversation. I want to thank the people behind the scenes of all of this: Ghazal, Nura, Ali, Weiss, Diz, Hina. This is the team behind TSN. They are putting out content and helping us put on this production all the time. Go check us out on our Instagram. If you're bored and at home and need something to do, listen to our podcast. Just search Samovar Network. Go onto YouTube, search Samovar Network for any of our other conversations. We talk about a whole range of stuff affecting the Afghan-American diaspora. Thank you so much for watching. Thank you to the panel for being here. And good night. Stay safe. Isolate yourselves.